Hello everyone, you're welcome to Passports Beyond Borders. We are living in unprecedented time and the coronavirus has impacted each and every one of our lives in unimaginable ways. And while the rest of the world stays home, our health workers, our doctors are out on the battleground risking their lives to save lives. I had the opportunity to interview health professionals from different parts of the world to know exactly what it means to practice medicine at a time like this and how the coronavirus has impacted their lives. So the first thing I wanted to know from them was their specialty and where exactly they practiced.
Christian Akemdemala. I am a specialty trainee in internal medicine and respiratory medicine at the University Hospitals of Leicester in the United Kingdom.
Dr. Manka Akumatimi. I'm a trainee in general practice in Portsmouth, United Kingdom.
Vivian Gang. I'm a nurse. I'm a registered nurse. I work at the Detroit Veterans Hospital. I'm also a doctorate student at the College of Nursing, Wayne State University in Michigan.
Dr. Swago Uchechukwu Levi. I am an optometrist.
Dr. Eileen Tayim. I am currently practicing psychiatry in Pennsylvania.
I'm a family doctor, so I'm a general practitioner, GP for short, and I work at Peterhead Medical Practice. I also do some shifts at the COVID hub in Aberdeen.
Nango Maiwo Nango, Cameroonian medical doctor working in the humanitarian and relief sector for over 8 years. I'm a GP, no clinical specialty, but I have a keen interest and experience in public health and healthcare delivery in conflict and humanitarian settings across Africa and the Middle East. Currently, I'm working in Yemen.
Dr. Chitwinso, I'm a pediatric doctor working at Queen's Medical Center in Nottingham in the United Kingdom.
What does it mean to practice medicine at a time like this?
I feel honored and privileged to be part of this. In all of it, it is a calling. You have to have the heart. You have to, have that zeal to go above and beyond to take this people to deal with these patients because they are at their most vulnerable stage, and all they need is for us to come in with a lot of compassion and take care of these patients.
There is lots of uncertainty regarding what's going to happen to you, what's going to happen to your patients, and it's quite tricky. This is simply because as medical doctors, we have that duty to look after patients, to save lives.
It's very scary. It kind of highlights the risk which medical practitioners are exposed to every day that we come to work. It also shows the importance of every healthcare practitioner. You've heard of cases where doctors have died of COVID-19.
It has been quite challenging working during this pandemic. The obvious worry of possibly falling ill and putting the health of my little children at risk haunts me, especially as my husband, who's a commissioned naval officer, is away. I just have to keep practicing safely, wearing my personal protective equipment as advised, and pretty much just respecting the government and health guidelines that have been put out with regards to this virus.
It's very, very challenging. We've changed the way we work completely, basically ripped out the practice book and have changed everything. We rely more now on telephone, video consults, rather than seeing people face to face. That's basically for their own protection.
Psychiatry is at the forefront of COVID-19 because a lot of people who already had borderline psychiatric illnesses are dealing with increased anxiety and depression. And even people who did not have anxiety, depression, we are seeing a lot more cases right now due to COVID-19.
A lot of people still think COVID-19 is a hoax, and they also think that the numbers the media is reporting is overstated. So can you paint a picture of what exactly the hospitals are like at a time like this?
This is serious, guys. We need to take this serious because a lot of people have lost their lives, including Black people, white people, people of all races, of all gender. Coronavirus is not for some reason, it's not really known to affect children a lot, or children are not known to have really severe illness. So unlike my adult colleagues, we're not really seeing a lot of workload, a lot of caseload, and a lot of the burden of the disease. So at the moment, anyone who comes to the hospital with a case of cough or fever, any coronavirus symptoms, we treat them as a coronavirus suspect until they have tests that come negative.
COVID is not a hoax. It is definitely not a hoax. This thing is killing people. It is ravaging lives. It is taking lives away. I'm so surprised that some people are so ignorant with all what is going on TV and what we see and all of that. Maybe because I'm in the medical field, I see a lot. But that notwithstanding, there's so much information out there telling people to do the right thing so they don't get infected and they don't get sick. A lot of people are so sick. I have my neighbor died of it, until it came really close to home. Then my kids, that was when my family actually knew that, yeah, this thing exists. Because when I come back home all the time and I tell them, they feel like, it's just one of those things. But it is really, really ravaging lives. And, it's just not a hoax.
And how people feel about COVID-19, but it's not fake. It's a real situation. I mean, if you don't believe in what the media says, I mean, you should walk into a hospital where patients are being taken care of and see how the agony people go through, even when they recover from the illness. Look, it is real. COVID-19 has made our hospitals very scary.
Obviously, the coronavirus is not a hoax. It is real, and the numbers prove it. People are quite unwell and are dying. Since the lockdown, telephone and video consultations are the new norm, and we are all adapting to it as the time goes by.
In Yemen right now, because it's Ramadan, we don't really have so many patients. There's not a great influx like you see in other parts of the world related to COVID. So there is not really much panic. There should be more alertness, but there isn't. Consequently, hospitals are not as populated as we would expect.
How have you been personally impacted by COVID-19?
Early March, I remember I was unwell with some symptoms. So I started having a cough, a sore throat, runny nostrils and a fever, and I was a bit poorly. Fortunately, not too unwell. So I was one of the first people in my hospital to feel poorly. And at the time, we weren't doing testing, so you couldn't tell if you had the virus or not. And because current government guidelines from then until now was that if you had symptoms, you had to stay at home, self-isolate, don't have contact with people. So I had to stay at home by myself, and I stayed home for about 9 days. So whether I had the illness or not, I wouldn't tell, but I think I may have had it.
I should normally be on holidays with my wife, but I locked down for I don't know when. So that's the biggest thing.
I am married, I have 3 children, but 2 of my kids are in elementary school. Right now, the children are home due to COVID-19, and my spouse and I are both essential workers. So what this means is that we are getting home at 5-6 p.m. and we are having to sit down with our kids and do school work. It definitely gives you a better appreciation for teachers.
So as a honorary research fellow at the University of Leicester, I had been out of clinical practice for about 3-4 months. I was involved in research on respiratory diseases at the University of Leicester. We had to put all our research activities on hold because we had to go back to support hospital staff and healthcare providers.
I have friends who have really been down. They've been really, really sick. We were thinking they were going to die. I have some of my colleagues, 2 of them that died of it. I have my neighbor, like I said, my neighbor died of it too. And so, emotionally I was getting drained. And at one point I thought I needed a mental break. So I requested for a 2 weeks break to stay home. And while I was in bed one morning and just, relaxing and just thinking about what is going on and how my colleagues are struggling back and forth, it just dawned on me. It just dawned on me like, Vivian, you don't have to sit down here at this time. This is not the time for you to take a vacation and chill out in your own house while others are struggling out there. People are dying, doctors are dying, nurses are dying, people are sick, and you're here. Then what do you call, what profession are you professing? So I felt so guilty, and then I called my boss and I said, you know what, put me back on the schedule.
On a more personal note, my training has been sort of interrupted with everything that's going on. Exams that I was due to take this April have been cancelled. So there's a lot of uncertainty about the flow of things, and we just expect that as things begin to normalize, all of that will fall into place accordingly.
But sadly, one of my colleague who I worked with down south in London when I was still doing locums several years ago passed away from COVID-19. So this is close to home for me.
I've lost some hours of work. Besides that, also we now work more from home. We don't need to go in most times to see any patient. So it's also giving us a different perspective to how we can effectively deliver health care.
In difficult times like this, it's important to have something to hope for. So tell me, what's giving you hope right now?
For things to really work properly and for the lockdown to ease them down, we need a vaccine. And these are things that normally take years to develop. But watching the news, reading various literature and seeing that there's lots of ongoing trials around the world already for a vaccine. In the UK, down in Southampton and Oxford, they've started vaccine trials. So it really gives you hope that, the future is bright, something is coming up, and very soon we can ease down on the lockdown and on the rules.
Knowing that we have the support of the public, knowing that we have people behind us who are staying at home to sort of reduce the pressure on the healthcare system, really gives us hope that all our efforts are not in vain.
And I live in Michigan. The curve is dwelling down a little bit. We are not there yet, but we're still struggling. And I hope and I pray, we're just praying that things will come back not normal as it was before, the way I see the way things are going, but to near normal. We just want to have a normal life.
The way everyone has come together, and even my patients, when I call them and I apologize, I'm sorry, I should be seeing you face to face for this, but due to COVID, people have been very understanding, and this gives me hope that, when people come together to work together, united against a common enemy, which is, albeit this is an enemy we cannot see, we succeed. No matter people of different backgrounds, everybody has come together to say that we need to fight this together, and that gives me real hope that we can defeat this thing.
I know that we serve a God who is good and who is alive. Despite everything we see around us, I know that God has a plan and that He will see us through.
The fact that this is not the first time that we are facing a worldwide pandemic of this sort in our human history. Of course, the impact is way worse than we've ever seen, but we've been through similar crises before. There was the Spanish flu, SARS, Ebola, and we always, as a human species, found a way to get past it, either to completely eradicate it through a vaccine or to somehow contain it, like we're trying to do with Ebola right now. So that's what gives me hope.
COVID-19 is not too different from other pandemics that the world has seen. So I'm thinking that at the end of this journey, the world will come back different. We'll return to normal life, normal work life. But again, people will now understand how to balance work and life.
My family is very supportive, and they've been able to uplift me when I feel low, and are just really fantastic. And of course, on a daily basis, the thought of just coming back home to get a cuddle from my daughters is just amazing. So
when all of this is all over, where would you like to go, and what exactly would you like to do?
Just having a week off where I don't have to go to work, I don't have to go to school, I just sleep in my bed, just listen to gospel music, just read my Bible, and just be able to connect with God.
I would like to meet again with family and friends and spend time with them, both here in the United Kingdom and back home in Cameroon. So
I would like to go somewhere where it is warm, somewhere with a beach, like Jamaica, like Hawaii, But unfortunately, it is difficult to plan or to buy a flight at this time because you are not sure when the COVID will be over, and you do not want to buy a flight and then at that time you're unable to travel.
I want to return back to days where I can go to the cinema with the kids to see a movie. I want the kids can go to school, go into the school to learn. Now they learn from home.
I did plan to go to Greece during the summer with a bunch of friends, so possibly when all of this is over and if it's still beautiful weather, I would possibly be going to Greece for a visit.
I want to go on a holiday away from everywhere, somewhere that is sunny and has blue water. That's what my wife usually says. With my wife and my kids, and we can just forget about everything and just relax and get some fresh air, and I hope that will be very soon.
The first thing I need to do is just travel, of course, with my wife and loved ones and friends. I'll definitely tour Europe. I love to tour Europe, visit as many places. But the first stop for me is going to be Seychelles.
There's just 3 things I would like to do at the end of the coronavirus crisis. 1, to travel. 2, to get my hair done, because currently I did this hairdo. I'm sure it's not too bad, but I could do with a proper hairdresser. And 3, I really just want to go dancing. I just want to go dancing.
Hello all, thank you so much for watching. If you haven't subscribed to this channel, please take a moment to do so right now. And remember, we are all in this together. Stay home and save lives. Thank you for watching. Bye.